So for today's presentation, we're going to be 4 different sections. The first part will talk about marketplace plans, really private insurance in general, and the different components of them. For those of you who are veterans, I'm sure you've become very familiar with that. And so some of what we'll also cover in that section is really how to explain some of those terms to consumers and some best practices we've learned over the years of how to talk about that. Then we'll talk about some trends we're seeing and what the issuers are offering in the marketplace, how plans are changing over time. We'll then talk about different strategies to integrate all that information into how to actually help consumers go through the process of comparing different plans and selecting the one that's best for them. We'll pause after the third section to take questions. And then we'll go into our last section where we're going to actually walk through how to help a consumer compare different plans for a couple different scenarios, so families. And we'll use the window shopping site on healthcare.gov and look at actual plans from this current 2020 year. So the first thing I want to do, though, before we get started, is ask all of you to do me a quick favor. On a piece of paper in front of you, just write down on a scale of 1 to 10, how confident are you in your ability and your skills in helping consumers go through the process to select a plan? From 1 to 10, just put that number down. Obviously, we want to see how you all feel after this presentation. So now we're going to dive right into the first section, talking about marketplace plans. And there are generally 5 different parts of any private insurance plan. That includes the premium, which we're not going to spend a lot of time on since most of us know how premiums work. There's all the dollar values for the cost sharing. So that's deductibles, out-of-pocket max, copay, co-insurance. All of those values are considered the plan design. That's how the insurance industry generally calls it, the plan design. In addition, there's the benefits that are covered, there's the drugs that are covered, and then there's the network of providers that each company has contracted with that members can go to. So let's go ahead and start on the plan design aspect, the cost sharing. So when you're looking on healthcare.gov, as you see this window shopping site, it's changed a little bit over the last 2 years. And so now it's laid out where, of course, you'll be able to see the premium there. That's the first thing most consumers look at. And then as you scan to the right, there's the deductible, there's the out-of-pocket maximum. And then there's the summary box in here that lists 4 of the common services that most people use: primary care, specialty care, generic drugs, and ER care. And that's often going to play a role in how we might do our search, which you'll see later on in the program. You also, as you know, can click on the plan details button, and that's going to take you to a more detailed overview of each plan that outlines, again, some of this information. Here on the bottom, you can click on the different sections and it'll open up, it'll expand and show you all of the different services and what the corresponding copays or co-insurance is. I will admit that in the past, it used to have all of this information already displayed in a one long list, and now you have to click section by section. I do find it a little more cumbersome because you can't see all the information right away when you scroll down, but regardless, that's how they're doing it here. In addition to the medical care, as you know, you can scroll down and click on prescription drugs, and it'll lay out the information prescription drugs or any other aspects of care that each plan covers. Another thing that every plan sold to the marketplace has, and in fact, every plan sold off the marketplace too, including what we all get through our employers or other types of coverage, it's this document called the Summary of Benefits and Coverage. And those of you who are veterans are probably very familiar with this. It's a document that just explains in much more detail all of these different items like the deductible, out-of-pocket max, how they apply, different exceptions. And as you scroll down, it'll show you other things as well, including the different services and what all of their copays and co-insurance are. So it's a great tool for helping display this information to consumers. And you can even print it out and give it to them so they can take it home so that as they get their coverage, they're able to kind of use it as a reference chart. So one of the things I often do when I'm in person at presenting at a sister conference is I'll ask everyone in the audience to raise their hand if they've ever had a consumer who's had a hard time understanding what a deductible or an out-of-pocket max is. And as you can imagine, pretty much everyone's hands go up because they are really confusing terms and confusing how they work in health insurance compared to other types of insurance. So during the first couple open enrollments, one of the things I might do is I might grab a piece of paper and just kind of draw out what a plan and how a consumer's experience might be. And say, you know, you're going to have a certain amount of medical expenses through the course of the year. And let's say you have a plan that has a deductible of $2,000 and this out-of-pocket maximum thing of $6,000. So here's how it works. In the beginning of the year, whenever you go and receive care, you're actually going to pay the full amount of those medical bills because you're in the deductible phase. So whether that's doctor visits or prescription drugs or hospital bills, you're paying that amount. Now, if all of those bills end up adding up to $2,000, you've now hit the deductible or you've met the deductible. And from that point on, you're just splitting the cost of any bills where you're just paying that dollar amount copay or the percentage of the bill, which is called coinsurance, and the insurance company is covering the rest of the bill. Now, for some people, they may not hit the deductible until pretty late in the year. Other people might hit it early in the year if they have some major health needs or an accident that happens early in the year. And then a lot of people never hit the deductible. But again, once you do, you're able to pay a lot less for the cost whenever you go and receive care. Now, after once you finish the deductible phase and you're in this phase, even then your bills and copays and coinsurance might add up. And in this case, if it adds up to another $4,000, well, now you've hit or met the out-of-pocket maximum. And so at that point on, you're not paying anything. The insurance company is covering the full amount of any additional medical bills until the end of the year. And again, most people don't hit that, but it's just sort of a protection there in case you happen to have a really difficult year when it comes to healthcare bills. Now, this is obviously a very oversimplified way of explaining some of these terms, but we hope that it can at least give a baseline of understanding for consumers who are coming in to look at insurance and often just focus on the premium and how they can find the cheapest premium. So another thing I want to highlight is something I find can be most important, which is first dollar coverage. And we just talked about how when you have plans, you have a deductible, whatever that value is, and then you'll have a lot of services where after you meet that deductible, you pay a copay or a coinsurance. Pretty straightforward. But many plans also have lots of services where you don't have to worry about that copay. In that case, the deductible isn't applying. So you can pay $50 for primary care or $10 for generic drugs in this case, and you don't have to worry about that big deductible. And they call it first dollar coverage because as soon as you pay your first dollars in premium, you're already getting the insurance company to start kicking in and paying for part of the medical bills for certain services. Now, you might see this labeled differently depending on how you're looking at the information for any given plan. You might see that they say that particular service is pre-deductible or exempt from the deductible or not subject to the deductible. You might also say the deductible does not apply to, say, primary care, or it's waived for generic drugs. It also might say that the amount of the copay, let's say $50 copay, is before the deductible for a given service. And then lastly, you just might not see the words after deductible next to that copay or coinsurance, like in the example we just saw. So again, for a lot of people, they may really find this value because they're looking for plans that are cheap. It might be plans that have big deductibles, but if it has some first dollar coverage, at least it helps them access care without having to worry that big deductible through the course of the year. Another thing I want to comment is on HSA plans. And HSAs are health savings accounts, and it's a financial instrument where you can put in money that's pre-tax dollars. And then you can use that as long as you get an HSA eligible plan. And that money, if you don't use that money through the course of the year, it actually rolls over from year to year. Now, there's a couple things for a plan to be eligible to be HSA, and it has to have a certain deductible that's above a certain amount, and then it also cannot have any first dollar coverage. So you have to meet that big deductible first, and then after that, you pay a copay or coinsurance. And the point is you're using that health savings account amount of dollars that are pre-tax to fund those healthcare expenses. Now, for some people, that might be fine if they have money to put in an HSA and they can take advantage of this. But the truth of the matter is, for most of the consumers we work with, they often don't have additional money that they can put into that account. And a lot of these plans, though, the HSA plans, happen to be on the cheapest end of the market whenever you're looking for bronze, for silver, or for other things. So they might be attracted to that, but if they do buy an HSA plan, they're basically getting a moderately big deductible or a big deductible, no first dollar coverage, but they're not benefiting from that tax exemption circumstance. So for them, there might be other plans, in this case, in the example on the right, that's a little more expensive, but has some first dollar coverage. So in this case, for primary care, for specialty care, and for generic drugs. But you'll notice it's only $25 more expensive. And so for this plan, that's $300 more per year in total premium increase. But if they go to the doctor a handful of times, chances are they'd be saving more money by going to the plan on the right. Now, another thing we often see is sometimes consumers are very confused about what counts towards the deductible. And they'll say they went and they received some care, but when they call the insurance company, it seems like they aren't any closer to meeting that deductible. And so let's just take this example. We'll use the chart from that previous example and just look at this plan on the right that has a $4,700 deductible and a $7,350 out-of-pocket maximum. And let's say we're looking at certain services where you have to meet the deductible first, and then after that, you get to pay the copay or coinsurance. And so let's say you go and receive these services, labs and preferred brand name drugs. Now, we don't know exactly what you'll pay because it's not always clear, and so you're paying whatever the pharmacy or the labs might charge you. But let's just use some examples of $120 for labs and $200 for that brand name drug. Whenever the consumer goes and pays for those services, that will count towards the deductible, and it will count towards meeting the out-of-pocket maximum. So pretty straightforward. But when we go and look at some of the services that are exempt from the deductible, in this case, primary care and generic drugs, we know exactly how much they'll pay because they'll be paying those copays and coinsurance. But in this case, those copays don't count towards the deductible. If the deductible is waived for those services, then those payments don't count towards it. However, they do count towards the out-of-pocket maximum. So it's just something to help explain in case a consumer is wondering about how these things work. Now, I want to briefly touch on the different metal tiers associated with plans. Again, if you're a veteran, you're probably very familiar with this. We have the different bronze, silver, gold, and platinum tiers. And in general, that just refers to how generous the plan is when it comes to the plan design. So if you look at it, platinum plans are going to have lower deductibles and bronze plans are going to have much higher deductibles. In addition, if you look at the copays, again, platinum plans will have, much lower copays and coinsurance. Bronze and silver might have much higher. And there might be more things exempt from the deductible on the platinum plans or gold plans. But you're obviously going to pay a lot more. So the real benefit is, do you want to pay more per month in a platinum plan or a gold plan so that you can pay less whenever you go and receive care? Or do you want to pay much less per month in, say, a bronze plan, but have to pay more of the expenses yourself if and when you go and receive care? Another thing is cost-sharing reduction plans, which often is a little difficult to explain to consumers. But as you know, if a consumer falls in certain income categories on the federal poverty level scale, then they might qualify for special silver plans that happen to be more generous. So in this case, these are the CSR 73, 87, and 94%. And so the latter two plans are actually better than gold and platinum respectively. And so you can see they have much lower copays if you're a lower income person. They have much lower deductibles compared to the regular base plan. But the person is charged the regular silver plan premium plus whatever tax credit they get. So if you have a person who's lowest income, not only are they getting a much bigger tax credit and so a much lower premium cost per month, they're also facing a plan that has a lot lower deductible or even no deductible and a lot lower copays. So one thing that's important to flag for consumers is around the preventive services. As you know, thanks to the Affordable Care Act, most preventive services does not have any deductible apply or any copayments or coinsurance. And there's a story I remember from one of my first few years as a volunteer certified application counselor, where I was sitting with a consumer. It was an older gentleman who was looking to buy coverage for him and his wife, and their income was around 300% of FPL or so, and so their tax credit wasn't really big. So the plans were quite expensive, but they had huge deductibles. These were bronze plans with nothing exempt from the deductible, very big deductibles. And it really looked like the consumer was about to leave without buying a plan. And I happened to have someone shadowing me who was a new assister, and they kind of brought up, hey, what about the preventive care thing? And so we ended up talking about that with the consumer, and he ended up buying a plan, the cheapest plan that was available, because that ended up being really important to him and something that he valued. And so it was an important reminder for me to make sure I'm not making assumptions about what is or isn't important to consumers and how much they're willing to spend to access those benefits. Another thing that's worth explaining to consumers, especially again if they're looking at just a really cheap plan that has a big deductible, maybe no first dollar coverage, is explaining this concept of the negotiated rates that you end up paying. So in this example, let's say someone goes and gets a couple office visits, they get some labs done. If they were uninsured, they'd get charged whatever those providers charge. And usually those are pretty expensive. Those are, their list prices. But as you know, every insurance company negotiates certain rates for every single service. And usually those rates are much lower. And they're called the allowed amount or the contracted amount or the negotiated rate. And so even though you're in the deductible phase and the insurance company isn't covering any of those bills, you're actually paying that negotiated amount. And so you're kind of getting the benefit of being a member, sort of like when you're a Costco member and you get benefits of having bulk purchasing or a lot lower prices for certain goods and services. So this is something worth flagging for consumers who are debating between not getting insurance or buying some plan that has a really big deductible and no first dollar coverage. Now, in terms of benefits, there isn't a lot to cover here. As you know, the Affordable Care Act outlined 10 different categories, what they're calling essential health benefits. For the most part, all plans cover these things pretty similarly. The only thing I want to mention is around the bottom one, the pediatric oral care or dental coverage for kids. And so when the Affordable Care Act was implemented, one of the things that it did is it said, if there's standalone dental plans that are sold in your area, then those medical coverage plans don't have to include it for kids. So you can see here the plan on the left, if a consumer ended up buying that plan, it does not include dental coverage for children. And so if they wanted coverage for their children, they'd have to go and buy it separately and pay a separate premium. Now the plan in the middle does include dental benefit for their kids. And so once they buy this plan, it's the one premium. They don't have to worry about any separate premium. Although I will mention that sometimes this dental coverage is not super comprehensive. It often covers, regular checkups and some basic care, but not other higher level types of care. And then the plan on the right actually included not just coverage for kids, but also for adults. And I know there's several consumers that when they learned that, they ended up being really interested in the plans that covered adult dental as well. Now moving on to prescription drugs, as you know, when you're looking on healthcare.gov, there's 4 different categories of prescription drugs. There's the generic level that's usually the lowest copay. There's a list of brand name drugs that are called preferred that have a slightly higher copay. Then there's all the other brand name drugs that are considered non-preferred. That'll have an even higher copay or coinsurance. And then a highest category of specialty drugs that usually has the highest level there. One thing I do want to mention is that now we're seeing some companies take the generic drug level and put certain generic drugs up into the second category, or they might even drop down some cheaper preferred brand name drugs into the first category. So I always think of these as tier 1 through tier 4 or level 1 through level 4, which is often how they're listed when you're looking on certain insurance company sites. The other thing I want to mention is that there might be a separate prescription drug deductible. So in this row here, there might be a separate dollar amount. It could be $200 or $500. And if it has a separate deductible, that means the consumer, whenever they go and fill their prescriptions, they'll have to meet that deductible first before they pay copay and coinsurance for any prescription drug needs. Now, often a lot of plans just have one deductible, and so it'll be a combined deductible of both prescription drug coverage and their medical coverage. It's just one thing. All the expenses you pay for count towards that one deductible, and only after you meet that do you pay the copay or coinsurance. But for most consumers, as you know, the most important thing is if they have a prescription drug, they want to know, is it covered and how is it covered? And so when you're looking on healthcare.gov, you'll always be able to click, or on your state-based website, you'll always be able to click and look at covered drugs. And it'll often either take you to the insurance company's website where you can search, or sometimes it'll take you to a PDF, like the example on the right, which is a little more cumbersome to navigate through. But here's just an example of looking at a particular drug and these 2 different insurance companies in Cook County, Illinois. And you can see the plan on the left covers it at tier 2, the plan on the right covers it at tier 4. And so that's probably going to mean very different copay amounts depending on which plan this consumer chooses. Now let's talk a bit about networks. And you're probably used to seeing all of the different alphabet letters that are applying to the different networks, HMOs, PPO, POS. And while there are a lot of differences that are subtle between them, the main ones that we can talk about is how they apply to their networks. So every company is going to have a contracted network of providers, doctors, hospitals, pharmacies that are in network. And then there's going to be other providers in the area that aren't in network for any of these plans that you happen to be looking at. For an HMO, in general, the consumer is going to have to go to a primary care provider that they select, and that primary care provider is going to let them have referrals or prescriptions to go get other other access to coverage. So they have this sort of gatekeeper model of a PCP that helps them access care. Now, if they go and receive any care out of network at a provider that's not contracted with, they're going to have to pay the full cost of that care. There's no coverage or reimbursement for that care in an HMO. Now, if you buy a PPO or point of service, it doesn't generally include that gatekeeper model. You can kind of go and receive care at any provider you want to go to. And there actually is some coverage for out-of-network care, although there's usually a separate deductible and it's usually a much higher copay or coinsurance if you go use that care. But some consumers may need that because they have very complicated health issues, or they want to go to a faraway provider that's a specialist in certain things that they're useful for. But PPOs and point of service generally are much more expensive than HMOs. So you're paying more for those different benefits. Now, soon into the Affordable Care Act marketplace years, a couple years ago, we've seen much more of the EPOs, or exclusive provider organizations. And this is basically a hybrid of the other two models where you don't have to worry about that gatekeeper, but you also don't get out-of-network coverage. Now, one thing sometimes consumers are interested in is you have all these different plans and these different networks, but you don't know how big they are. And so one thing I've done is, here's an example of looking at the number of primary care physicians within a 10-mile radius of a particular zip code in Nebraska. And you can see here, there's a lot of different companies and different plans. And so the plan on top actually has two different networks. They're both PPOs, and it has a couple hundred primary care docs within that radius. And then you look down below, there's another company that has 4 different networks. And in general, that's because they might have contracted with different health systems in their area. And so the point of service actually has fewer providers than the 3 HMOs. So we're used to thinking PPOs and point of service have more doctors in addition to covering out a network, but it's not always the case. And then the bottom 2 ones actually have the most providers in this area, but the PPO has quite a bit, but the one with the most PCP docs in this area is actually the HMO at the bottom. And so it's sometimes useful to check the size of the networks when you're starting it during the open enrollment, so you can get a sense of how each plan compares to each other. But again, much like prescription drugs, if you have a consumer, most often what's most important to them is if they have a provider they're used to seeing and they'd like to continue seeing, they want to know if that provider is in network or not. So on healthcare.gov, when you're looking at any given plan, you can click on the link for provider directory and it'll show you, is that provider in network, yes or no? So now let's move on to some of the trends we're seeing in the marketplace. And one of the things I want to highlight is we talked earlier about how there could be an important value in finding plans that have some first dollar coverage, some coverage that's exempt from the deductible. And what we're seeing now more and more is some plans, especially bronze plans that are cheaper end of the marketplace, are not waiving the deductible entirely for, say, for primary care, but they're letting you have a couple visits where you don't have to worry about that deductible. So in this example from Fairfax County, Virginia, you can see that for the first 3 visits you pay a $25 copay. You don't have to worry about the deductible. After that, you then have to worry about the deductible. And then after you meet the deductible, you pay 35% coinsurance. And so I just want to show you how that looks on healthcare.gov. As you can see here in that summary box, it shows you $35 / 35% coinsurance. And when you scroll down below again with the primary care doc row, you see it lists it the same way. Now you'll notice they don't mention how many visits you get in this screen. You can either look at the summary of benefits and coverage like we just showed, or you can click here on the link that's below it in the same row, the visit limits and exclusions. And when you do that, a pop-up will show up and it'll show you how many visits you get before the copay. So for this example, 5 visits without having to worry about that deductible. So again, this is a plan where if you have a consumer that's just worried about the premium cost, they want to pay as little as possible, and they're looking at a plan that has a big deductible, there might be some plans like this where they have a couple visits that are exempt from the deductible, so that could meet their basic healthcare needs for the year. Now, on the other end of the spectrum, we're seeing some plans where they have a deductible that's actually so high, it equals the out-of-pocket maximum. And so whenever you go and look at the services and how much they cost, there's actually no charge, because once you've hit the deductible, you've hit the out-of-pocket maximum. And so this kind of functions more like how auto insurance or homeowners insurance works, where you cover the whole amount of the deductible up front, and then they cover all the rest of the bills. So it's kind of like catastrophic coverage. For some consumers, if they're generally pretty healthy and don't have a lot of healthcare needs, then that might be fine for them, just protecting them in case something bad happens. But if a consumer has some health needs, especially if they have a lot of health needs, this kind of plan is putting all the financial burden on them up front until they meet it. And so it might be beneficial to them, but there might be other plans that are a little more expensive per month, but actually do serve their needs in a better way. I want to flag something else we're seeing a lot more when it comes to prescription drugs tiers. We mentioned before that there's 4 tiers of prescription drugs. Well, it turns out that's not entirely the case. Some companies are actually splitting that generic tier into a preferred and non-preferred list. And so the preferred one has a much cheaper copay. And some are even taking that specialty tier and they're splitting that into 2 tiers. And I've even seen occasionally some 7th level tiers. So instead of having 4 tiers, you could have anywhere from 6 to 7, depending on how each plan structures their formulary. And the reason this matters is because you might be looking at two different plans, and a consumer might have a prescription drug, and the two plans might cover them at, say, tier 3. But that tier 3 could mean different things depending on how many tiers the plan has, so it is important to go ahead and check that out and see what the specific copay is. But healthcare.gov only has 4 rows on its website, so you really need to look at this summary of benefits and coverage to catch that. Another thing we're seeing is that some carriers are slicing their networks into different tiers as well. And you pay a low copay if you go to the tier 1 level, and you pay a higher copay if you go to one of the higher tier levels. So I just want to show you how that example might impact a consumer. In this case, with the plan from Philadelphia, Pennsylvania, where if they go to a primary care visit to the tier 1 provider network doctor, they pay a $30 copay, and they pay a bit more if they go to one of the higher tiers. But you can really see this difference if you go down and look at what the facility fee is if they have an outpatient surgery. So a same-day procedure. If they go to a tier 1 facility, it's a $250 copay, and you don't have to worry about the deductible. But if you go to a tier 2 or tier 3, not only is the copay higher, but now it is subject to the deductible. So that consumer could be paying thousands of dollars more for the same exact service, depending on what tier of facility they're going to. So when you're helping a consumer and they're trying to see is their provider in network, it's important to see not just are they in network, yes or no, but what tier they might be in if that company has a tiered network structure. Now, another thing that's been really difficult for a lot of us for years, even before the Affordable Care Act was passed, is the issue of how inaccurate a lot of the health plan directories are when you're trying to find providers. And a good friend of mine, Claire McAndrew from Families USA, many years ago did a research study where they just cold called a bunch of providers in different health plans in certain states. And they found, anywhere from a third to a quarter to a half of different numbers were incorrect. And here's a more recent study that was done, and it was reported in Commonwealth Fund. And it was done in Medicare Advantage plans, but a lot of plans that sell Medicare plans also sell plans in the marketplace. And it shows when they called, they found a quarter to almost a half of the numbers were incorrect. Some of the providers had moved from that area. Some had disconnected their number. Some had retired. Some had even passed away, and they never updated that information. And so it can be very frustrating. So if you're sitting with a consumer and they're looking at different plan options, and they're going to make a decision on which plan to buy largely based on which one covers the provider they care about, I often recommend you call the provider and call the insurance company to double check that information. And I would even suggest getting the name of the person who told you that information, because sometimes they don't even know or they make mistakes. Now, a couple things I want to mention is related to some of the changes that have happened to the Affordable Care Act, either due to the current administration or to Congress, and how they've sort of weakened some protections of the Affordable Care Act. Now, one of the things they did is they removed the subsidies that went to health plans, because the health plans were offering, remember, those more generous CSR plans, the silver plans. If a person was lower income, they offered plans that were more generous, but they weren't charging the consumer anymore. So the difference in what they should have been charging for how the plan actually would be valued and how much they actually charged, that difference was made up by the federal government through these CSR payments. When the administration removed those payments several years ago, it means the carriers were now faced with a loss. And so what they did is they generally increased the price of certain plans, the silver plans. Now, what that did was a couple different things. One of the things it did is if you were someone who didn't get tax credit, you were seeing a lot higher premiums across the board. But if you do get tax credit, like in this example of a family of 3 making a certain amount of money, they got a pretty big tax credit because, as you recall, tax credits are indexed to the second lowest silver plan. So if all the silver plans have gone up, that means the tax credit's going up. So here you can see one of the things it did is it made a lot of bronze plans free or very, very cheap. And so that's something that now a lot of consumers are seeing, a lot of cheap bronze plans. So for those who are just looking for something where they don't have to, don't have a lot of health needs, that's made them very affordable. In addition, it's also shown a circumstance where we're now seeing gold plans that are actually cheaper than silver plans, because the silver plan price has gone up quite a bit. And so this is often for people without tax credit. Some of the gold plans might be a little cheaper, but have lower deductibles or lower copays. And so occasionally we're seeing some consumers now buy gold, which wasn't really something we've often seen in those first couple years. One of the things I'm sure you all are very familiar with is that the current administration has decided to dramatically lower the amount of funding they've provided for Navigator programs in the 34 FFM states, the ones that use healthcare.gov. And so it's gone down to just $10 million, both for this current year and now what we're leading into next year for 2021 plans. And I know that's been very difficult for a lot of you who've lost funding and have had to, make difficult adjustments through staffing. But we're hopeful that perhaps in the future, somehow there might be more additional funding that comes forward to support your great work. And then lastly, in trends, I just want to mention that, as you know, due to the pandemic that's impacting everyone around the country and around the world, the federal government passed the CARES Act, which added some important requirements around, testing and other things related to COVID-19 being covered without any cost sharing or any deductibles, because we want to encourage people to go and receive care and get tested so that they're able to help us curtail the spread of this intense pandemic. Now I want to move on to section 3, just how can we really help consumers walk through this really complicated process of comparing plans. So one of the things you can do is, as you're preparing for open enrollment, as the plan information becomes available for 2021, you can kind of map them out and you can see how things changed from the previous year. So here's just an example of how in the plans that are sold in the area where I volunteer, I looked at 2017, and when the 2018 plans came out and that open enrollment, I just compared them, and you can see some companies left the market and other companies joined the marketplace in our area. And the cheapest area plans happen to be different companies offers. And then the same thing from 18 to 19. And you'll see from 19 to 20, it actually didn't change that much. And one of the things I often do is really focus on the 4 cheapest plans in the area, because that's often the area that consumers tend to buy because, at a certain point, the prices become too expensive. So as soon as the plans come available in your area, I definitely encourage you to look at the ones both in silver and in bronze and get familiar with the ones that tend to be on the cheapest end, so you really know, are they HSAs or not? Do they have the child dental? What are the copays? What are the deductible? What's the first dollar coverage? So you're able to explain the differences better once you sit down with your first consumer. So the other thing you can do is you can actually do that thing I did around comparing the different network sizes. So wherever you are, you can, put in your zip code, put in this case, a 5-mile radius, and I just calculate how many different providers of different categories are available across the different companies in our area. So for you, I did primary care, cardiology, OBGYN, peds, and hospitals. And you can add to that list any additional types of providers that might be very sought after among your community. And if you're in a rural area, maybe you could, expand that radius to 25 miles. And you can have this as sort of a cheat sheet on your table as a guide in case someone's interested in knowing how big are these different networks. So now let's talk about how we really tailor the search to any given consumer when they walk in the door. And one of the things are they a renewal or a new applicant? If they're a renewal, well, then you know that they just had health insurance last year. And so you can ask them questions. How was that covered? Did you understand how it worked? Was the deductible issue okay? Were you able to get providers that you needed? And so that can help you walk through the process for what they're looking for this coming year. But if they're a new applicant, then you're sort of starting from scratch. And chances are you're gonna have to spend a lot more time, not just on the application side, but also in walking them through some of the basic elements of health plans. And so chances are that appointment might be a lot longer. Another thing, again, is, of course, if someone has prescription drugs or providers that they really care about, then that's going to largely drive some aspects of their search. And for some people, it'll be really, really important. For other people, it might not be as important. But we want to make sure we get that information from them so we're incorporating it into the comparisons. But I do want to mention, sometimes folks don't have any prescriptions and they don't have any providers, or maybe they don't feel comfortable sharing, but they still have a lot of healthcare needs. And so it's really important for us to talk to them about what is their overall health picture. How often did they use care last year? And do they have anything that they think they might need next year that's special? So a surgery, maybe they had a recent injury and so they need to get rehab services. And so it's really important for us to get the whole picture of what someone's healthcare needs are when we're looking at the different plan options. Now, another thing that I mentioned before early on is that first dollar coverage might be very important to consumers. And as you can see here, when we're looking at healthcare.gov, this is actually the old layout from a couple years ago, but it's very similar as the new layout, where you're going to have that summary box where you can see, is there any coverage offered with first dollar coverage? And so you can see here, in this case, the one on the bottom, the second plan actually has some first dollar coverage. And as you scroll down, it'll show you more plans. And then, these ones actually have more first dollar coverage. And you can keep scrolling down and you see the plan on top now has more first dollar coverage. And so you can kind of use this to help, as you're scrolling down, you're comparing across the different factors, balancing the price with other factors like deductible and first dollar coverage and other things. But one thing I often mention is that imagine that as you're scrolling down, that there's sort of a rubber band. And the more you scroll down, the more tension you're getting. And at some point, you're going to have to stop because that's really correlating with the premiums, because the premiums are going up as you scroll down. And so we're kind of balancing how much a consumer might be open to paying in premium with the different benefits and value that might come from a slightly more expensive plan. So now let's really talk about the overall comparison process, and the selection process is all about trade-offs and priorities. So the first one is, comparing between bronze and silver plans. Bronze plans are cheaper, but tend to have much higher deductible, maybe no first dollar coverage. Silver plans are more expensive and might have lower deductibles and some more first dollar coverage. And so you kind of talk to the consumer. Well, in this case, this example, there's a $47 difference. And so are they comfortable paying that to be able to get those different benefits? Is that benefit worth it for them for that difference in price? There's a similar phenomenon when you're talking about whether or not providers or prescription drugs are covered. So here's just another example of two plans. And you can see the plan on top is more expensive, it's cheaper, but doesn't have a provider. The plan on the bottom is more expensive, but it does include the provider. So again, you can say, hey, are you comfortable paying $42 more to be able to keep seeing your provider? For some people, they might say, nah, I don't want to. I'm happy to change my provider. I don't care. I want the cheaper plan. And for other folks, they're very happy to pay, or very willing to pay more money. In some cases, we heard in focus groups, it could be $50, $100, even $150 more to keep seeing that provider. A couple last things to talk about is now, because there's different changes to the Affordable Care Act, the prices are more expensive and the individual mandates removed. And so some people might say, why even bother buying coverage? Maybe I'll just go uninsured. And you can remind them that even if that plan's expensive, has a high deductible, remember, preventive services are covered no charge. You're paying that much lower rate for negotiated rates instead of the full cost of coverage when you get care. And then insurance is really all about risk, is covering risk in case of a major accident or a major health diagnosis. And so you can kind of mention to them, like, I know $184 is expensive. I know there isn't a lot pre-deductible, but how worried are you about in case something happens? Because that could really have huge medical bills. A lot of people even go bankrupt for medical bills. So we can talk to them about what they feel comfortable doing and what the plan options are. So now I want to stop there and turn it over to my colleagues to see if there's any questions before we go on to the last section.
Thanks, Dave. We do have a couple of questions. What resource do you use to determine the number of providers within a particular insurance network?
So on healthcare.gov, as I mentioned, when you're looking at each plan, there's going to be a link to their provider directory. And so you can click on it, and usually it takes you to a website where you can put in, your zip code and what kind of provider you're looking for, what radius. Sometimes you might have to choose which health plan from that company, and so make sure you're choosing the right plan. And when you do that, it'll show you how many providers are in network, and it'll list the different providers, how many, PCPs, et cetera.
Can you explain once more the concept of first dollar coverage?
Sure. So one of the things we talked about in the beginning is how the deductible works. And in general, you have to, pay for all of your healthcare services out of pocket until you accumulate enough bills that you've paid that equal whatever the deductible is. And then once you've met the deductible, then you're paying, the copay and coinsurance. But there are a lot of plans on the marketplace that actually exempt some services from the deductible. So they say, hey, it's often either primary care and or generic drugs, and occasionally it's specialist care. And then if it's a more generous plan, it might have even more exempt from the deductible. And all that means is that as soon as you buy that plan, on day one, you don't have to worry about the deductible for that particular service. So if you go to the primary care, don't worry about the deductible. You're just paying, let's say, for example, the $25 copay. Or you get the generic drugs, you don't have to worry about the deductible if those particular services are exempt from the deductible by that plan.
Great, thank you. And one more question. Is there an easy way to find out what tier a provider is?
So usually when you're looking on the provider directory of that particular company, it should list when it has the provider listed there. If there's a tiered network, it'll say tier 1 provider, tier 2 provider. I will admit it's not always easy. And so again, calling the provider and calling the company to make sure. While there are more companies that have tiered networks, it's not widely used across the country, or if it is, it might not be for all of the providers. It might just be for hospitals and those kind of things. But again, so it is something we have to take that extra step to go and double check. It could be something worth doing at the beginning of the year, especially with hospitals, because that's often something that folks might care about. So find out which hospitals are in network for each of the companies in your area and just kind of make a cheat sheet again, like the cheat sheet I showed before, just list the hospitals in that bottom box.
Great, and we will pause once more at the end for questions. So keep them coming in the Q&A box.
Great. Now let's move on to our last section where we're going to go on to healthcare.gov and look at how we might help 3 different family scenarios around the country navigate this process. So the first consumer is a 32-year-old woman who's from Roanoke County and makes $32,000 a year. So as we talk to her through the appointment, we're going to learn more about, what her health status is. And let's say she says she's pretty healthy, doesn't have any providers or prescriptions. She's just worried about cost. She wants to see what are her options and how expensive is it. So we're now going to go on to healthcare.gov together and see how it works. So let's click over to the browser and we'll just quickly zip through on the window shopping site what her options might be. So in this case, it's just one person. And so we'll put in her age and gender, and then we're going to put in her income. And it'll calculate an estimate of how much her tax credit might be. In this case, $317. So now we can go ahead and look at the different plan options. Now, she doesn't have any providers or prescriptions she mentioned, so we don't have to add that to our search up top. And you can see here the cheapest bronze plan is $57. It has a pretty big deductible, and it looks like it has nothing exempt for the deductible. When I click on the plan details and go look at medical care, you see that it has either 40% or 50%, and it does seem like it has a tiered network. So this is a plan that really puts a lot of the cost on her, but one of the things I see is some consumers often are open to looking at more expensive plans, but often want to compare what the added value is compared to the cheapest option. So in this case, let's say she wants to include this option in a search, and I generally recommend let's find 2 to 4 plans for them to consider. So let's go see if there's other plan options, maybe something with more first dollar coverage. And we can scroll down here and we can see here's another plan that's $73. It has primary care exempt from the deductible, but nothing else. And if we keep scrolling down, we see another plan sold by the same company. It has a slightly higher deductible, but now it has generic drugs and a couple visits in primary care. We can, again, as I mentioned, click on the plan details and go look up how many visits. And when we do that, it shows you it has 5 visits where you don't have to worry about the deductible. So maybe she says, hey, I don't mind that because, in case I, need a couple visits, that's a good thing to include. So we can include that one in our search. Now, maybe she mentions, well, these are really high deductibles. And so she wants to know, are there other plans that have a lower deductible? So one of the things we can do is go up top and filter for silver plans. And when we do that, now we can see there's a silver plan that's a lot more expensive, but it actually has a pretty big deductible too. Now, it does have first dollar coverage, but let's say she really wants to find one with a lower deductible. Here's another plan. It's $226. It has a much lower deductible and some first dollar coverage as well. So we can include this one in the search, let's say, and we go ahead and compare the plans. Now, one of the things I mentioned is that to really compare all the factors, we have to go ahead and open all this, and so it's hard to see all this on one screen. So for our purposes, we're actually going to use a model based on this document that we created several years ago called the Marketplace Plan Comparison Worksheet. And it's a tool you can use to fill out all the information manually to really help explain how these plans work and to be able to see it all on one page. For our purpose, let's just use this table. And you can see here's the 3 plans. The cheapest one on the left, big deductible, nothing exempt from the deductible. Plan in the middle, a little more expensive, slightly lower deductible, and a couple stuff that's without worrying about the deductible. And the plan on the right, much more expensive, but a much lower deductible and other things that are exempt, including tier 2 drugs. So for every consumer, they're different in their values and what they prioritize. And so hoping in the course of asking her questions, we can talk to her about what are your priorities. And for most consumers, it's just finding a cheapest plan, but also balancing that with deductible and copay amounts. And then in this case, we say, is there first dollar coverage? Is that something that's important to you? And how much more are you willing to pay to have the access to that benefit? Now, in this case, based on what her priorities are, and every consumer is different, hopefully she's able to navigate that and decide the plan that's best for her. So now let's move on to our second scenario. And this is a married couple from Jacksonville, Florida that makes $24,000 a year. And let's say they mention that the husband has diabetes and takes a particular medication for it and also gets a lot of lab work. And then let's say that the wife has a particular OBGYN that she really likes seeing and would like to keep seeing. So let's once again go back to healthcare.gov and let's see what the options are for this particular family. So let's go back and restart the process here in their particular county. And I'm just going to fly through this. There's 2 of them that are married and don't have any dependents. And so we'll put in their ages. And then we're going to put in their income here of $24,000 a year. And now it estimates a pretty big tax credit of over $1,100 a year. And it also has this blue box down below that says they might be eligible for extra savings if they pick a silver plan, which is basically code for saying they qualify for those silver CSR plans. And in this case, I actually, because I put their income at below 150%, I know they probably qualify for that really generous 94% CSR plans. So let's go ahead and look at the different plan options available to them. Now you can see right away, because of that big tax credit, they qualify for free bronze plans, which is something I mentioned earlier that's happening now in different areas. But before we look at the plans, why don't we go check how their providers and prescriptions are covered. And so let's first look at their provider, and let's put that in here. And you can see the providers here, and then we're going to add the prescription drug, in this case metformin. Now, one of the things you'll see is that when you put in a prescription drug, it lists all of the different kinds of dosages. And so it is important to know what dose each consumer needs. And so I often recommend asking them to bring in their prescription vials, or at least knowing what it is, writing that down and bringing it in. In this case, they're doing the 500 milligram one, and so we'll put that in. And now we can see how those different plans cover their provider and their prescription drug. Now, as you can see here, these bronze plans are free, but they have really big deductibles. And they may or may not cover the provider, and they might cover the different prescription drugs in different ways. Now, because they qualify for CSR, we might say, hey, why don't we go look at silver plans? And that's often what we do with folks who have a much lower income who qualify for that. But sometimes some consumers, now that we have these free bronze plans, they're really attracted to that. And so in this case, maybe they're looking at this top one, because you'll notice even though it has a big deductible, it actually has some first dollar coverage for primary care and generic drugs. And when we click on plan details, remember he mentioned labs. And so let's go down and see how labs are covered. And you can see it's 40%, but after the deductible. So let's say they're open to like just considering this plan, because again, a lot of folks want to see what their options are compared to a cheaper plan. Let's include that, but now let's go up and take a look at those silver CSR plans. So you can see here, the cheapest one is $59. It has no deductible and pretty low copays. It does cover metformin, and when I looked it up, it actually is covered at tier 2. And you see that there's, when we look at how that's covered, that's a 25% co-insurance under the prescription drugs here. So maybe they're open to this plan as well because it's the cheapest silver plan, and $60, maybe they can afford it. It has a much lower deductible. But it doesn't include their provider. And so maybe that's something that's really important to them. And so one of the things you can do is you can either scroll down to find a plan that has the provider until you see it, or you can click on the filter, and you can see here on the right-hand side, you can click on the medical doctor, and that way it can include that in the search. And so it shows us that the cheapest plan that includes the provider is $91, also has no deductible, no copay for generic or primary care, and it does include the provider as well as the prescription drug. And I checked it and it's at tier 1. Now, sometimes you might want to double check this information, the provider directory. So why don't we go ahead and check that real quick. Let's go here and see, we click on access to doctors and hospitals and click on view. And now we're going to go ahead and see, is the provider in network or not, yes or no. And so on this site, you can see here we can search for a particular provider's name, and we're looking in their area. So we want to put in the zip code of this case. And now we can search. And now it'll show us whether or not the provider is in network, yes or no. And so you can see here on the left, it shows us that in fact she is in network. Sometimes I found though, that when you're looking and it shows that they're in network at healthcare.gov, that isn't always accurate. Or it might say that they're not in network, but they turn out to be in network. So again, double checking this information on the insurance company site is important. So now let's include this one in our comparison. And now we have 3 plans for them to look at. But again, let's switch over back to our slides and see how this looks at in a little easier way. So we have the plan on the left that's free, big deductible, some first dollar coverage, but doesn't have the doctor network. And it covers the medication, but at tier 2. So that would be 40% coinsurance, and they would have to worry about the deductible. The second plan from the same company is $60 or so, has no deductible, so all the things are first dollar coverage, but again, it doesn't include the provider. But the tier 2 drug now is covered at 25%, and again, there's no deductible. And if they pay up a little more, another $31, they get a plan that also has no deductible, but in this case does include the provider. So once again, we can talk to them about what are their priorities. So we have the same priorities as before. We might include whether or not they include things like adult dental, whether their current doctor's in network or not, if their prescription drugs covered, and then what's the best plan that meets their overall health condition. So he mentioned labs. Some people might want chronic disease management or other services as well. So now let's go on to our third scenario, which is a family of 3 from Milwaukee that makes $36,000 a year. And let's say their daughter has asthma and sees a particular provider for it and takes medication for it. And let's say that the father actually is considering a surgery and a friend had a recent surgery that was at a particular hospital nearby and that they maybe recommended that place. So now let's go ahead back to healthcare.gov and let's put in the scenario for this person. So once again, I'm just going to fly through building the case example. And we're going to put in the different persons here. There's multiple people, including a dependent. And let's put in the family, ages, and genders. And we'll go ahead and put in their income of $36,000 a year. And it shows us they probably qualify for a tax credit of almost $1,200. And once again, eligible for CSR plans. So let's go ahead and look at what their options are. Now again, we see that there's free bronze plans now because that tax credit is really big. Before we get started though, let's go ahead and put in information about their prescription drugs and their providers. So here we're putting their provider. This is the one on the left. Make sure you're looking at the right one based on where they're located. So we'll add that. Let's also add the hospital that they mentioned that the husband is considering. Now for hospitals, they often list different ones. And so you want to make sure you're looking at the right one in the right city and the different care center it is. So in this case, let's say it's the multi-specialty clinic in Milwaukee. And then we want to add the prescription drugs. In this case, it's the Advair inhaler. Once again, we're going to need to know the dosage. And let's say in this case I do. It's the one on the bottom left, the fourth down. And now let's look at their plan options. So they do qualify for CSR, but once again, now that consumers are facing some free bronze plans, let's say they're interested in some of them. Now this one's free, has a huge deductible, but if you can see, it has the primary care doctor and the generic drugs that are covered without the deductible. It says the drug is not covered, but actually when I double check that, that's incorrect. It's covered at tier 3 out of 5 tiers. So it's actually 50%, but after deductible. And in this case, it says the hospital and the providers in network. What's interestingly enough is as of 2 weeks ago when I did this example, this provider was not listed in network. That could have been an error in the provider directory of the company. Maybe the person just signed on in the last 2 weeks. For our example, we're just going to say they're not in network for this case. But let's say we go ahead and compare this plan. But let's also look at those silver CSR plans because they do qualify for them. And you can see here the cheapest silver is $45, has a much lower deductible of $1,000, but in this case it doesn't include either provider. It says it doesn't include Advair, but it actually, when I looked, it says it does cover the generic version at tier 2. And so maybe that's something they're open to. Now some folks might not want to look at any plan that has no providers in network, but in this one it actually has some benefits. Let's say they want to include this one. But let's say they want to find a plan that does include both providers in network and covers the prescription and has, some low copays, et cetera. So we can scroll down. Here's another plan that has no provider network, but it's actually, in this case, we say that it doesn't have the doctor network. I know that I said it did, but in this case, let's say it doesn't, based on what was happening a couple weeks ago. We scroll down. Here's another plan that's a little more expensive. In this case, it does have the provider and the drug in covered, and I verified that that's correct when I double checked it. And the drug's covered at tier 1, so it's much cheaper. Now it does have a deductible, but it doesn't apply to a lot of the services when I checked it out. So let's say they're open to looking at this one as well. So once again, let's compare these plan options on our slides. And now we see we have the cheap bronze plan that's free, big deductible, some things exempt from the deductible, but doesn't include the provider, and has the drug up in a tier 3 of 5 tier formulary. The plan in the middle is more expensive. It's $45, but has a pretty low deductible that doesn't apply to a lot of things, but doesn't have either provider. And then the plan on the right is much more expensive. It does have both providers, covers the drug pretty cheap, has a modest deductible that doesn't apply to some services. Now, one of the things you can often see is a consumer's going to say, you know what, I just can't go above a certain amount. So let's say in this case, they drop that highest one. And now we're comparing 2 plans, a cheap bronze and a little more expensive silver. And one of the things we want to do is walk through maybe how they would be impacted by either plan based on their healthcare needs. So let's say we talk to them and we try to get a sense of how often they might use care in the coming year. Maybe how often did they use it last year? And we can see how many visits did you have, primary care specialists, how often they get the prescriptions. And we don't always know how much those cost in terms of the actual cost when you're in the deductible phase, but you can kind of Google $100 primary care visit in your zip code or in your county, or how much an average surgery costs for the surgeries getting in that area. And so when we look at the plan on the left, obviously it's free because the plan's free, but when you're going and getting care, they're going to end up paying a lot of the full amounts for the different services. So in this case, it could be almost $7,000. Now, let's say the plan on the right is a lot more expensive, right? It's 45 bucks. It costs about $500 for the year. But because the deductible is lower and it doesn't apply to a lot of things, they'd actually end up spending $2,700 out of pocket. Now, obviously for each consumer, it might be different depending on if their healthcare needs are different, but this is how we can understand what the potential value is of that more expensive plan based on their particular healthcare needs. So now we've added a couple different priorities for them to consider, including which providers to prioritize if some plans cover one and not both. And then also really figuring out what plan's best for them financially based on the total amount they're paying, not just premiums, but also the deductible, the out-of-pocket costs in copays and coinsurance based on what their health needs might be. So now I want to turn it back over to my colleagues to see if we have any questions before we close out.
Thanks, Dave. We did have a couple of more questions come in. Do you have any tips when helping consumers who are primarily interested in behavioral health and addiction recovery services?
Sure. So, all plans are supposed to cover mental health, and because of mental health parity, they're supposed to cover them no differently or more expensive than other services. A lot of plans I see cover them the same as primary care. So whatever the copay is for that, it'll compare there. Sometimes they cover it at specialty care, which means it'll be a little more expensive. But the plan should cover it. And when you're looking at the cost of services in those, screens I showed you, when you scroll down, it'll also show you not just, primary care, labs. When you scroll further down, it'll show a section of behavioral health that shows you what's a mental health outpatient visit, that's either out of the hospital, or mental health outpatient visit, so a therapy visit in the hospital, and then hospitalization for a mental health visit as well. It'll have all those copays and coinsurance listed there.
Great. And one last question: how do you locate the different plans in your area?
So when you go to healthcare.gov, you can put healthcare.gov/C-plans. Or when you're navigating, there's on the site, and I'll show it really quickly. When you go to the main healthcare site, you can see you want to get ready to apply. And one of the things you can do is you can preview health plan prices. So you click on this, and this takes you, in this case, it's not taking you there. So now it gets you to this C-plan site where you put in the zip code and everything I just mentioned. And so for you all, it might be that before November 1, sometimes the feds do release the new plans that are available on this website. It might be a couple days before November 1. The earliest I've seen it is about a week before. Otherwise, it might not be released until literally November 1. And so I suggest, as soon as it comes live, go on there, do some of that prep to get a sense of what the plans look like, what their prices are, how they look.
And because we've gotten a few questions about this, I'll just let everyone know that we will be sending out a new plan comparison chart in the next couple of weeks. So you'll be able to use that when you're comparing plans with your consumers. So that's it. I'll turn it back to Dave.
Great. So the last thing I just want to see is if I can ask you for a really important favor. If you wouldn't mind going to this link, when you get the slides, you're going to get this link as well and follow up. And it's just a quick evaluation. So the first question is what I asked you before. On a scale of 1 to 10, how confident were you in your skills in doing this before this presentation? And then, of course, the next question is, how do you feel after this presentation? Another couple quick questions on the topics. Were there any topics that weren't in the presentation that you think should be added? And then, were there any topics that weren't useful and you think it's probably time to remove because they don't really apply anymore? And then, were there any topics that were in the presentation but you thought weren't really explained well enough and needed some more time or energy focused on that? That'll really help me improve this webinar from year to year as we move forward. And then lastly, on a scale of 1 to 10, how would you rate the content of the training? And then how would you rate the delivery of the training? Because that'll really be helpful. And with that, I just want to really wish you good luck. I know the past couple of years have been very, very difficult, as a lot of changes have happened to the Affordable Care Act to make it less supportive of consumers. And I know it's meant that a lot of consumers have had more complicated situations, and I just really appreciate all that you're doing to help consumers. I think it's one of the most meaningful jobs out there right now, especially given the pandemic and the health issues that folks are facing. I think you all are doing amazing work, and I just thank you for that and hope this year goes well. So with that, I'm going to turn it back over to my colleagues to close us out.
Thank you so much, Dave. As a reminder, we'll be distributing the materials from today's session via email, and we'll post everything to the Beyond the Basics website at www.healthreformbeyondthebasics.org. The next part of this webinar series, covering the auto renewal process in healthcare.gov, is scheduled for this Thursday, October 8th, 2 p.m. Eastern, 11 a.m. Pacific. You can register for upcoming webinars on the Beyond the Basics website, and if you have questions or need assistance, please email our Beyond the Basics contact email at beyondthebasics@cbpp.org. With that, we'll bring today's webinar to a close. Thank you for joining us today.